Welcome into Feeling Good Feels Good. I am your host, Dr. Tripp. This is the podcast where we discuss total wellness and outright wellness, where we look at wellness through a lens of 4 different categories: mental, emotional health, physical health, nutritional and chemical health, as well as lifestyle, habit, and environmental health. Today, we're going to go in through a chemical and environmental episode. This is one that's going to help a large chunk of the population and has helped me throughout the course of my life. Do you ever feel like your chest is tight and like you can't take a full breath? Not only is it hard to deal with, it's hard to explain. That's asthma, and it's more than just wheezing. It can mess with your day, your sleep, your mood, your workouts, your confidence. It can really affect your entire life. And sometimes it can just show up out of nowhere. Today, I want to break down asthma in a way that makes sense. I want to help you understand what's actually going on in these asthma attacks and how to recognize which type of asthma you may have. And I want to help support people understanding how they can take care of their asthma. When we understand why it's happening, what's going on, and what our triggers are, it gives us the tools to be able to fight off this incredibly troublesome issue. Asthma is a whole body problem. We need to look at environmental, mental, physical, as well as chemical to really open the hood here and understand what's really going on. By the end of this episode, I hope that you will be able to understand your specific situation or the situation of somebody that you love and care about. I will even go into detail about how I got rid of my own asthma. It was something that greatly impacted me throughout the course of my life and why I no longer suffer from symptoms of asthma today. With all of that, let's dive in.
Welcome to Feeling Good Feels Good with Dr. Tripp.
Welcome to a state of feeling good. It's how we live and how you could. Just know it's how we're all meant to be. If things are off, listen to your body. It can tell us exactly what we need. Physical, emotional, nutritional, or mentally. No need to worry, it's reached accessibly. No matter how you felt or what you've heard, well-being's for everyone, it's what you deserve. Ease and joy are yours once it's understood. No need to fear, because feeling good feels good.
The information in this podcast is intended for educational and informational purposes only. It is not medical advice and should not be interpreted as a diagnosis, treatment, or prescription. Listening to this podcast does not establish a doctor-patient relationship. Always consult your own healthcare providers before making any changes to your health, medications, or treatment plans. The opinions shared here are based on clinical experience, research, and professional knowledge, but they may not apply to any specific situations. By listening to this podcast, you acknowledge and agree to these terms.
So for all of our loyal listeners, you may have noticed a little switch in terms of how I did the intro. And there is a couple things that I realized looking at my most recent episode. We talked about meditation for over 20 minutes, and I didn't even talk about how I use meditation. I realized that bringing information and data and real life applications is extremely helpful, but hearing more about the real life experiences of myself and my patients is an important message to deliver as well. So if you didn't listen to last episode on meditation, go back, check it out. And what I will add in is how I meditate. I am using the Headspace app for about 10 minutes each day. I find the courses in the Headspace app extremely helpful. You can search nearly anything from stress, anxiety, financial problems, all the way down to specifics like competition in sport or creativity for writing. So if you're looking for an easier into meditation after listening to our last episode, go to the Headspace app. They give you the first 30 days for free as a trial. Try it out and type in whatever you're curious about, what you want to work on, and look for a course that matches you. And I have no doubt that you will feel better. So let's dive into asthma a little bit. Today's topic: what is asthma? At its core, it's a chronic lung inflammatory disease. In asthma, the airways to our lungs become hypersensitive and overreactive. They can narrow, tighten, swell, or even produce excess mucus, all of which make it harder to breathe. And that matters a lot to people who suffer from asthma. Breathing is an essential body function, if not the most essential function. And when our airways don't allow for this to happen easily, the entire quality of life can suffer greatly. And there are different types of asthma. We have allergic asthma triggered by allergens, things like pet dander, dust, mold, pollen, or other environmental factors. We have non-allergic asthma, which can be triggered by non-traditional allergens, things that we don't usually think of when we think of allergies. This might be cold air, smoke, strong odors, infections, or even stress. There is exercise-induced asthma, where physical activity, especially in cold or dry air, starts to constrict the airway. Technically, occupational asthma has its own category, but it's very similar to non-allergic asthma, where workplace environments trigger or worsen symptoms of asthma. Things like chemical irritants, more dust, fumes, or anything unique to a workplace that can trigger a person's asthma. About 9% of adults suffer from chronic asthma. And while the percent in children is slightly lower, there can be higher incidence of acute asthma, and symptoms can be more severe as we don't always understand yet where they're coming from, and the body is not used to dealing with them. In children, asthma tends to be slightly higher in boys than girls, but in adults, asthma tends to be slightly higher in women than men. The highest prevalence of asthma is in children of low-income families. It jumps to almost 11% of the population. And the lifetime asthma prevalence, meaning somebody was ever diagnosed with asthma at some point in their life, is rising. It's jumped from 9% in 1999 to almost 14% in 2022. This is almost double. So let's talk about the causes. What causes asthma? There are two main things that we want to look at: genetics and environment. We've probably heard this a lot of times before: nature and nurture. And both of them can affect the likelihood of somebody having asthma or severe asthma. Somebody can be genetically predisposed to getting asthma, but our environment will have a major impact on whether somebody experiences asthma symptoms or not. Exposure to pollutions and chemicals like cigarette smoke, bleach, car exhaust, or industrial fumes can irritate the lungs and trigger inflammation. We talked about allergens, exercise, cold air, and stress as other environmental factors. Early childhood development can affect these outcomes. What is somebody exposed to? Too much or too little? Some people have a hygiene hypothesis where children are exposed to too few germs, so that when their immune system does start to encounter irritants, it did not have the right training growing up. So clearly, we're already starting to see a little bit of a balance here. We want to minimize harmful exposures like smoke, like bleach, like fumes and exhaust. But we also want to ensure proper development of the immune system through exposure to nature. Let's think about asthma roots in two major categories: allergic and irritant. Allergic reactions come when our immune system encounters something harmless like pet dander, but for some reason sees it as a threat and overreacts. An irritant exposure will directly trigger inflammation through irritating the lungs. When the overreaction or inflammation kicks in, you might hear wheezing, coughing, experience chest tightness, or even shortness of breath. These symptoms are not the same for everyone. Some will have mild intermittent asthma, while some may have severe persistent asthma. The main type that I experienced growing up was allergic asthma, with a lot of wheezing and shortness of breath. The way I might experience this would be exposure to an allergen or irritant, and it would be extremely hard to breathe, and it would sound like I'm whistling out of my throat when I'm breathing. I will tell the full story of my experience towards the end of the episode, how it shifted in adulthood, and how I live asthma-free today. Allergic asthma can have seasonal flares, like spring pollen or fall mold spores. And of course, you can have indoor allergies, pet dander, dust, mold. And then irritant asthma is when you're surrounded by things that irritate your lungs. Exercise-induced asthma can be a little easier to identify. You start to have asthma symptoms as you ramp up your physical activity. So, understanding what triggers you, allergens, irritants, or exercise is essential and is the first step in taking control over your symptoms. If you didn't remember all of that, don't worry. It's going to be talked about a number of times throughout the course of this episode as we give real life stories and steps. To understand this even further, let's take a look at what's happening in the body during an asthma attack. Basically, the airways of the lungs, the bronchioles, get tight. These aren't like normal tubes, they're dynamic. They can change size, shape, and pattern based on what's going on in your life. One of the foundational components of an asthma attack is inflammation. One of the reasons the airways constrict is because it gets inflamed and swollen. Think about a hose. If the walls get thicker or swollen, less air can get through. Bronchoconstriction is when the smooth muscle in your bronchioles, your tubes, actually goes into spasm and gets tight. So think about that hose with less space due to swelling, and then think about somebody squeezing it. Air is now having a very tough time getting to the lungs. This is the body's reaction to triggers, allergens, and irritants, trying to prevent these things from entering our system. Again, it's a hypersensitivity. There can even be excessive mucus. So that same hose that's swollen, squeezed, can start to fill up or clog up with mucus, blocking the way even more. At this point, this person is probably having a pretty severe asthma attack, wheezing, shortness of breath, fatigue, extreme irritability from lack of oxygen and blood flow throughout the body. Again, these can happen from mild all the way up to severe. It can be slightly annoying all the way up to a hospital emergency. So the wheezing sounds like a high-pitched whistle when air is trying to get out of the lungs. The coughing comes from the body trying to clear out mucus. The sounds of asthma, wheezing for one, and coughing come from these restrictions in the hose, the bronchioles. Wheezing comes when air is trying to escape during outbreath, but there is such little room that creates the sound of a whistle. And the coughing comes from the body trying to break up excessive mucus. Not only can't you get oxygen into your bloodstream, but you also can't get rid of carbon dioxide fast enough. That's why asthma attacks feel so scary. The body is struggling to keep up with what it needs to function and exist. Oxygen powers every cell in the body, so decreased oxygen leads to a decreased functioning of every body system. The heart can speed up, trying to pump more blood to get more oxygen throughout the body, can create a racing pulse or the sensation of being lightheaded or dizzy. The digestive tract can slow down. On top of that, stress can flood your body with hormones like adrenaline or cortisol. These chemicals can leave you feeling anxious or on edge. This can feed into the asthma cycle, creating more inflammation, more stress, creating more symptoms. That's why the attack is so hard to stop. If you've seen somebody having an asthma attack or experienced it yourself, they're generally not going to be in a good mood. Once the attack eases, either naturally or through intervention, the body starts to repair and reset. The nervous system calms down, the heart rate slows, and your body begins to clear out mucus, a process that can take hours or even days. The inflammation can stick around, and the nervous system can still be hypersensitive even well after an asthma attack is over, which can lead somebody suspect for another attack or to not just be functioning at their best self. So asthma isn't just a lung event. It's a full body experience that affects your heart, your digestion, your nervous system, and your mood. Knowing what's happening in your body and how it's reacting can help give you more clear tools on how to deal with certain asthma attacks. Long term, asthma can create scar tissue in the lungs. Doctors will refer to this as lung remodeling. Think about it as scar tissue building up from constant irritation. The scar tissue can stiffen the airways over time, making them less flexible, and this can lead to permanent narrowing. But there are ways to reduce this. These changes can affect your ability to be physically active, to exercise, play sports, or just go for a run, or jump into an activity when you feel like it. This can create sensations of fatigue, decreased mood, and overall poorer quality of life. Asthma is not something that you typically want to ignore or just wait it out. Consistent management can increase short term quality of life, like right now, decrease your asthma symptoms. It can start to break this cycle of chronic inflammation, chronic attacks, and hypersensitivity, which affects all body systems, and it can negate long term implications. What's the one thing that we all think about for asthma treatment? Inhalers. So, what's going on with an inhaler? Most of the time, they are bronchodilators. They relax those tight airways, that garden hose, release the squeeze, and it happens fast. This is very important. We want to always reduce the frequency and severity of the asthma attacks. The longer they go on, the more this cycle sets in. So, initially, inhalers to break the cycle of asthma attacks is very important. Nebulizers are used for serious attacks, and steroids are frequently used to calm the inflammation. Managing the environment is obviously crucial. There are also allergy shots, immunotherapy, a therapy that I believe in greatly and has helped me throughout the course of my life, as well as various patients of mine. Since asthma is all about inflammation inside your airways, these treatments aim to quiet down your system's overreaction. But there are more ways to address the root cause of this inflammation. This can be extremely person dependent. People become inflamed for different reasons. Some may be more reactive to environment. Some may even be reactive to their own levels of stress. Food can even come into play in certain situations, as well as endurance and exercise physiology. So, what are some other things that we can be doing to address these causes? We talked about inhalers as a short term treatment. We also talked about allergy shots as a long term treatment. Acupuncture has been shown to support calming the inflammation in the body's airway. Chiropractic adjustments have been shown to be incredibly anti inflammatory and can help improve the functioning of the overall nervous system. So, acupuncture and chiropractic not only help provide the short term relief, but start to break down the cycle of a hypersensitive, overactive nervous system and body. Breathing exercises are crucial. They help decrease inflammation, calm the mind, and teach the body how to breathe properly. Diaphragmatic breathing is something I would highly recommend in these cases. Stress and anxiety are highly correlated with asthma and asthma attacks. Getting to the root of stress and anxiety through things like journaling, meditation, and therapy are a key piece to breaking the cycle of hypersensitivity and chronic asthma. Somatic practitioners believe that fear is a big emotion that contributes to tightness in the chest. They also believe that being trapped emotionally correlates with air being trapped and getting in and out of the lungs. Trapped in a poor situation, a poor relationship, or unable to live freely correlates with being unable to breathe freely. Experiencing trauma, distress, or emotional shock can make somebody more hypersensitive to these attacks. Trauma therapies like EMDR can support and even accelerate the breaking of these cycles. Nervous system dysregulation is generally seen in people with asthma. It can be a chicken or the egg situation. Asthma does cause nervous system dysregulation, and somebody who is genetically predisposed to asthma will experience attacks with nervous system dysregulation. So, any regulating practices for your nervous system will help. Sleep, breathing, yoga, meditation, and mindfulness. In acupuncture and traditional Chinese medicine, some providers might look at liver and kidney imbalances contributing to respiratory distress. So, seeing a good qualified acupuncturist can be a very good asset when trying to overcome chronic asthma. Okay, with a chemical response, we need to look at what chemicals we're putting in our body, aka nutrition. Again, everyone is different, but the main foods you want to try to avoid or test through elimination diet are dairy, processed foods, which cause a lot of oxidative stress and inflammation. You can try other common allergens like wheat, gluten, nut, and even soy or corn. So, elimination diet can be helpful. It is difficult to do a true elimination diet, but if you're experiencing asthma, you know that you'll do whatever it takes to figure this thing out. Whenever we talk about inflammation, we have to talk about the gut microbiome. If you have a microbiome that is off, it is going to cause systemic inflammation. Doing functional medicine gut tests, elimination diets, gene testing, or just starting with basic, fiber-rich and healthy foods will assist in decreasing chronic inflammation and symptoms of asthma. There are, of course, anti-inflammatory foods that you can take, the most popular being turmeric containing curcumin to decrease inflammation through your diet. My favorite supplement that has helped me the most is NAC, N-acetylcysteine. This helps break down mucus and scarring, as well as increasing glutathione, which is the master antioxidant for the body and the main antioxidant for our lungs. Remember, antioxidants prevent damage, tumor, illness, disease. So this one is key. I do love NAC for most people with chronic lung issues. Quercetin acts as a natural antihistamine, which has less harmful effects than some of the mainstream antihistamines out there, which can also affect the gut, which can keep you in this loop of cycle. Take antihistamine, affect the gut, have more systemic inflammation, take antihistamine, so on and so forth. Omega-3 fatty acids like fish oil are going to pop up in so many episodes. It's one of the supplements that I recommend to nearly anyone to improve their health and wellness, and they have so many applicable traits, even for asthma. These healthy fats get into the cell membranes and help produce molecules called resolvins. Funny, yes, they help resolve the issue. What they do is actively turn off inflammation. Omega-3s can also help modulate the immune system, promoting less overreaction. Vitamin D. This hormone-like vitamin helps regulate immune cells called T cells, which control inflammation in the lungs. Studies even show that people with lower vitamin D levels have higher asthma symptoms, higher frequency of attacks, and more severe attacks. Lastly, magnesium at night can help calm our muscles. And remember, the bronchioles, the hose that we were talking about earlier, are made of muscle. So calming the muscle calms the swelling and the restriction. So before I wrapped up, I promised a review of how I dealt with my asthma. And I think this can be enlightening to a lot of you. When I was a kid, asthma felt like a lot of wheezing, tightness of breath, and it felt like it would come out of nowhere. Cold weather, exercise, allergens, and irritants all felt like they could trigger me at any moment. So all four of the main types seem to contribute to this somehow. Over time, into early adulthood, I began to be more purposeful about my environment. I started to pick up on things that may trigger my asthma: harsh chemicals, cleaning supplies, Glade plugins, dust, mold, and especially pet dander. I started to realize that most of what was going on would happen inside or being physically active in extremely cold climates. I began to control my environment and reduce these triggers. On top of that, I began to eat better food and supplements that I knew could reduce inflammation, a major component of asthma. Over time, the symptoms really cleared. I didn't feel like asthma was as big a part of my life anymore until we got a dog. We got this dog, and I never felt so much asthma in my life. It was like it all came back 10 times over. Even with getting rid of the dog, this triggered the cycle of hypersensitivity. So I had to take it to a new level. I addressed it from all angles. One of the main things that I give credit to are allergy shots. I found out what I was allergic to and built up my immunity to these allergies through allergy immunization. My doctor says 80% of people who do it get 80% better. And I felt like I could take care of the rest of that 20%. Mindfulness, breathing, routine therapy, physical exercise, and addressing any stress reactions I had from my emotions, just like it does with everything else, helped with this. I did take NAC regularly, along with vitamin D, magnesium, and fish oil. Quercetin would come in to play sometimes, but the others were really my key supplements, honing in on my diet and breaking this cycle for good. I now have 2 dogs at my home, and I haven't had an asthma attack in years. I hope that my story can help you all take more control of your asthma symptoms And remember, it comes from all angles: our environment, our genetic predisposition, allergies, mindset, emotions, and even diet. Addressing what's contributing to this cycle from all angles can greatly reduce your symptoms and improve your quality of life. I can't wait to see you all next time on the next episode of Feeling Good Feels Good.